Hypertension. It's often called the silent killer because those who have it have no idea they are affected because they don't feel sick. There's a common misconception that someone with hypertension or high blood pressure might suddenly experience sweating, flushes, headaches, nervousness, nosebleeds, or even have some trouble sleeping. But none of that really happens. Someone with hypertension might not know it until it's too late. Today on Medical Matters, we'll tell you why it's so important that you check your blood pressure. It's highly recommended that anyone 20 years or older should check their blood pressure annually. Hypertension or high blood pressure can only be detected by actually measuring your blood pressure.
Hypertension is a condition that is defined according to the South African Hypertensive Society as an elevated blood pressure that is persistently elevated beyond the pressure of systolic of 140 over diastolic of 90. A lot of patients with hypertension are asymptomatic. In other words, they may not necessarily have the symptoms. And usually and commonly, it's an incidental finding. That is why it's important that when patients go and visit their doctors, one of the things that needs to be done on a regular basis will be blood pressure checkup. Then there will be a group of patients who are symptomatic, and the symptomatology ranges from according to what organ is involved. So in other words, the blood pressure, as it were, it's it's got a systemic presentation. You may have a blood pressure affectation of your brain, or you may have affectation of your other organs like the heart and the kidneys.
Measuring your blood pressure is done with the aid of a pressure cuff, which is placed around the upper arm before being inflated. This is done either manually or electronically. Once that is done, the cuff compresses what is known as the brachial artery, stopping the flow of blood for a few seconds. It's then slowly released, allowing the doctor or nurse to get a measure. Now, normal blood pressure is less than 120/80. Anything higher is cause for concern. If undiagnosed and untreated, hypertension can cause organ damage and put you at risk of serious illnesses like heart disease, a deadly heart attack or a stroke, even sexual dysfunction, to name a few.
Blood pressure and hypertension is a silent killer. So it may very well be fatal because if it's elevated to a point where it may affect your target major organ. The major organs that I'm talking about is the brain, where you can have a stroke, you can have a transient ischemic attacks, you can affect your heart, you can have acute heart failure, you can have acute myocardial infarctions, you can affect your kidneys, where your kidneys may actually fail. And therefore, it's a necessity that we need to treat it. And if you don't treat it, it may very well be fatal.
We really should be doing everything we can to prevent hypertension.
So in terms of lifestyle, the considerations are as follows. You need to exercise. You need to be within reasonable body weight. You must not be overweight. You need to have your glucose controlled. You need to have your cholesterol controlled as well. And your salt intake, if you are hypertensive, must be at least 1 teaspoon, which is 6 grams. And that obviously play a role in terms of blood pressure control. And once those measures are in place, then you can go into a secondary level of care, which obviously involves your pharmacological therapy, where there's a wide range of medication that are available that can be used to control the blood pressure. One of the most important factors to think about will be things like drugs, anabolic steroids, non-steroidal anti-inflammatory drugs that people use for pain relievers can elevate your blood pressure. Tick as a illicit drug use that is being used can actually also elevate your blood pressure. More importantly, other things to consider is obesity, advancing in age, the association with diabetes, lifestyle, alcohol consumption, as well as smoking.
It's a quick, painless checkup at least once a year that could save your life. Checking your blood pressure is something you can even do at home with easy-to-use equipment. Remember, you are not going to see or feel that you have hypertension, so don't wait for signs, while the silent killer may be lurking inside you.